Welcome to the Caregiver Education Group. We are so thankful that you're watching this, and we hope this is a resource and tool for you as a caregiver while your loved one is hospitalized. In this presentation, we want to make sure you get a better understanding of what to expect while your loved one is hospitalized, who the care team is for your child or loved one, what our goal is while your child is here, namely crisis stabilization, which we'll talk about a little bit more later, what to bring your child while they're family participation looks like, what programming and school is like for a stay, and how to prepare for discharge. We appreciate you being here and ask that confidentiality of other caregivers is respected and personal information is not shared outside of this meeting. One of the reasons for creating this presentation was that we understand that when someone's loved one is in crisis, that means that the family and others involved are also in crisis. We know intake can be overwhelming for a lot of reasons. So this is another touching base point for you all to get a refresh on what your child's stay at Prairie Care entails. Support from others is a really important part of supporting your child. And we want to make sure that you all have this resource. So NAMI Minnesota has free support groups that are both online and in person for caregivers of children dealing with mental health concerns. So this can be a great tool for connecting, supporting, and learning from other families who've gone through some similar situations with their kids. And then the information is here on the slide. So if you need to stop the presentation to write down the phone number or website, please feel free to do so. On this slide are a few pictures of our hospital. You'll see one at the bottom right, um, and that is what a typical room looks like. All of these pictures and the frequently asked questions that you see over on the left are located on our website at prairie-care.com/treatment/inpatient-hospital. Also, if you just Google Prairie Care Inpatient Hospital, you'll find it right there. But feel free to go onto that website and check out some more of those photos and some more of those FAQs if you'd like. So there are some different terms that we use to identify different groups of professionals at Prairie Care that interact with your child. So the first one on this slide is treatment team. And your treatment team consists of your child's psychiatrist, therapist, and social worker. You'll likely be hearing from all members of the treatment team during your child's stay. But their social worker will be a point person for you to contact if you need to contact someone on the treatment team. The social worker will also be reaching out regarding discharge planning while your child is here, so they'll keep you informed throughout your child's stay about what's going on. Your child will have individual therapy while in the hospital about every other day, and we do ask that families participate in family therapy once a week while your kiddo is here at Prairie Care. Another term that we use is the nursing team. So this includes nurses that are on your child's unit and the psychiatric technicians that are with the milieu throughout their days. So if you need to contact your child while they're here, the nurses line for your child's track would be the best way to contact them. I believe that number is on a slide coming up too. So if you need that, get a pen and paper ready. Um, so other professionals that may be interacting with your child are some primary care consultants for any physical health concerns, spiritual care providers if your child requests. We have some cultural liaisons, we have art and music therapists, recreational therapists, occupational therapists, and we also have a treatment education liaison. So the average length of stay here at Prairie Care inpatient is 7 to 10 days, and that includes weekends. That is an average. We do like to point out that discharge plans are all individualized. So that looks different for every kid, but that's kind of the average, just so you kind of know what to expect. Our focus while they're here is really on stabilizing whatever the presenting crisis is. So your child may leave here and you're like, okay, not everything is, you know, going exactly how we wanted it to. And um, one of the ways that we want to help with that is just by developing some aftercare plans for ongoing treatment at a less intense level of care. So that process is collaborative. We want to make sure that there is stabilization with your kid, and also that we can help provide some resources that work for your family. So you're a part of that as well. The treatment team will kind of recommend a level of care, and the social worker will provide some resources and help work with you to create an aftercare plan. What to bring? So, if your child needs some clothing or things while they're here, you're welcome to bring some. We ask that it is limited to up to 5 sets of clothing, undergarments, and socks. Um, Main reason for that is just that it's a short stay. We have a lot of kids here, so we want to make sure that every kid leaves with the items that they brought in. We do ask that you avoid bringing any clothes with identifying information like their last name or school, um, or city or anything like that. Um, Also, we ask that you avoid clothing with strings. We want to be sure that every kid is safe here. And even if that's not something you're concerned about for your child, we do have to consider other children on the milieus. Some other things that you can bring is a blanket, a pillow, some shoes without laces. Um, some kids also really want some shower shoes, and any religious or cultural items that are important to you and your child. What not to bring. So, kind of the catch-all is really anything that could be a safety concern. And again, we're thinking about, not just one child, but the whole unit and sometimes even the whole hospital. So, um, some of those things include food, flowers, plastic bags, any valuable items. So, no phones, no purses or wallets, jewelry, anything like that. Um, no vapes, no nicotine products, no medications, supplements, anything like that. Um, all medications will be provided here in the hospital that your child needs. And then um, they are given a hygiene kit when they intake here. Um, and so that'll contain, some body wash, shampoo, conditioner, all of that good stuff, everything that they would need for basic self-care. So we do ask that you don't bring any of those items either. Um, a lot of things are really provided here. It's more of those like extra clothing items or comfort items that your child might want while they're here. If any of these products are brought, it's 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 okay. We just have some lockers that we um, can lock some things up so that none of the kids have access to it. But your child will get that back at discharge. So. Okay, this is that slide that I mentioned earlier. So if you're trying to reach your child or you're just also wanting to call the unit and say like, hey, how's my child doing today? What have they been up to? The nurses line is definitely the best line to contact them. So hopefully you've been made aware of your child's track. You can see the different tracks on the image on the slide. Um, Feel free to write down that phone number if you don't have it already for the nursing line to your child's track. All right. So this is just a little bit more in depth on some family participation. Again, I mentioned earlier, but um, we typically ask that families participate in family therapy once a week for an hour. So normally it's just the legal guardians. If you have more like extended relatives that are really involved in care, we can kind of take that on a case to case basis. But most of the time, we want to keep it small. And again, a lot of the times our focus is really on safety planning. This is ideally in person, but we do have a telehealth option as well because we know it can be hard to get here for that. Visiting hours are 9 a.m. to 7 p.m. daily. All visitors must be on the call or visit list, which can be updated by guardians. So if you want to update the call visit or the visit list, feel free to call the nursing line um, and get that updated for who can come visit or who can call. And then when you do come, please just bring a photo ID to check in at reception. Again, visiting hours are 9 a.m. to 7 p.m. So we encourage visitors to be mainly primary caretakers, parents, and guardians. There is a limit to 4 on the visit list. This doesn't include minor children, however. So if your child has some younger siblings or minor siblings, they can come as well. But we do ask that at one time there's a limit of 3 total visitors. So however that works out for you and your family, we just ask that you be aware of that. And then we also ask that peers and friends are not coming to visit or call your child while they're here. We want them to really focus on um, stabilization, um, and we our capacity is really for guardians and immediate family. So while your child is at Prairie Care, there is a set schedule. You'll get to see one of these schedules on the next slide. Um, but some of the activities that they are involved with while they're here, they have music therapy, art therapy, occupational therapy, recreational therapy. Those are all really fun groups that kids love participating in while they're here. Another really important group is process group. Um, this is led by social workers and therapists in the hospital, and it's really just group therapy and time for kids to support each other on their tracks. There's school, which we'll talk about in just a little bit. There's some gross motor time. We do have some gyms and some outdoor spaces as well. Um, and then just in general, the milieu, we want kids to also have time to rest and engage with each other in more relaxed and informal ways as well. So this is an example of a typical schedule. This happens to be the moon track. Um, but this is what a schedule would look like. You can see some blocked times for school that happens at the same time every day, process group, same time every day, lunch and recess. Um, During the week, we really try and keep it pretty routined. Um, but yeah, okay. So school while inpatient includes 2.5 hours of classroom time every weekday during the school year. So kids can earn credit hours for their classes, and we encourage it because it's a great opportunity for kids to practice things that they're learning in other programming in a setting that focuses on social emotional learning. Teachers are there to help coach students around how to manage stress within a classroom setting, so that can be helpful for some kids. And students are given pretty individualized attention while in school. There are 2 teachers to every classroom, and typically the classroom size is around or under 10 kids. So they'll learn social studies, literacy, and history. And if you would like your child to be in school while in the hospital, someone will be reaching out to you to get your permission to enroll them. And they will need to unenroll from their current school district and re-enroll in the district here, which is ISD 287. But outside of just giving your consent, that shouldn't be any specific work for you. We do have a specific um, treatment liaison, education liaison that helps with that whole process. So if you decide you don't want your child enrolled in school here, there's no alternative programming, and your child will be in their room during that time each day. So we have had parents that bring schoolwork for their child to do during that time from their school, but we do ask that it be on paper because electronic devices aren't allowed on the units. Um, so that's just something to be aware of. Preparation for discharge. So discharge is very much an individualized process and can be influenced by a lot of different factors. Your loved one's social worker will be reaching out to you to give updates from the treatment team and to work with you to figure out when a good time for discharge is. So in that, they'll schedule a day and a time for you to come and pick up your child for discharge. And the social worker will also meet with you that day to kind of go over final aftercare plans and the safety plan. So every patient leaves prairie care with a safety plan. This is something that a lot of families discuss during family therapy, but we also encourage it to be a conversation between you and your patient prior to discharge. Um, we want a lot of involvement on this process. So we want the family's input as well as the patients on the safety plan because you all know kind of what will work outside of here um, and what won't. Common aspects of a safety plan. So we really want families to identify some safety concerns, some stressors and triggers, warning signs, and then also some coping strategies. And this is something that we focus on a lot in the hospital. So hopefully your child has gained some new coping strategies while they're here as well. We want to be able to identify who can support your loved one and what they can do to support. So some common safety considerations that actions that are made while they're here. Um, and we also ask that your child is able to see a primary care provider, usually, about the week after they leave, just to make sure that if their medications were changed, that they're still doing okay. There's no weird side effects going on. If your child has started medications while they've been hospitalized, you will receive a 30-day refill at discharge. And Prairie Care can't refill this after the 30-day supply is gone. So that's another reason for seeing a doctor shortly after stay is just to help kind of keep that medication regimen going or make any necessary changes. So another transition that can be a little daunting for kids while they're here is transitioning back to school. So some of the things that we have found is helpful is just communicating with your child's school. Um, as much as you're able to about their transition back. So even while they're here, they're not even discharged yet. If you're able to, it's always great to provide some communication to your school about what's going on and what their needs might be as they return. So on the day of discharge, like I said, the social worker will be calling to schedule that with you. And discharge will be scheduled prior to noon on the day of discharge. Um, in that discharge meeting, parents meet with the social worker to review the aftercare recommendations and the plan, as well as the safety plan. And then once that's done with, the social worker will call the nurse, and you'll meet with the nurse and your child to review any discharge paperwork and medications. So, all in all, it takes about 30 to 45 minutes. One little tip that we like to give parents is if your child doesn't have shoes or like a jacket, depending on the weather, um, we do recommend that you bring them for discharge. Sometimes, kids come from the ED and they don't have shoes and they've been wearing socks while they're here. And so it's just nice to have shoes or a jacket if needed as they leave here. So we recognize that there can be a lot of concerns coming from caregivers as that discharge happens and transitioning outside of being inpatient. Um, so some of those things that we talk about in family therapy and can talk through with safety planning as well as just changes in expectations at home. Sometimes there are changes in privileges with cell phone use, driving privileges, alone time privileges. That's a big one. Um, and that's part of what we're here to help work through. So know that you're not alone in figuring all of that out. And then some other, common things that we hear is just like, what do I tell their siblings? What do I tell family and friends? Um, and I think, obviously every situation is a little different. And so, that is something that can be talked about in family therapy. Um, but also, I think um, it's okay for you all to reach out for help as well. And that's part of why we created this presentation. So thank you so much for watching this, and we hope it's been a tool for you in feeling equipped to care for your loved one while they're here at Prayer Care and then after that.